We're dealing with a reservoir using a bag valve mask. You would like the liter flow to be at least 15 liters to fill up the reservoir, so that way we're giving supplemental oxygen to the patients. Now, what I wanted to deal first is responder 1. If you are holding the mask in place, you can be perpendicular to the patient. However, it's more beneficial not being perpendicular to the patient, but rather facing the patient from head to toe. If we're facing head to toe, as you can see with this bag valve mask over here, there's a pointy part and there's a round surface. You guessed it right, the pointy part goes to where the nose is, the round part goes where to the chin is. So, small little minute details. When I'm holding the mask, it's important that I don't get fixated on pushing the mask to the face, but rather holding the mask in place and pulling the face to the mask. In other words, I would like to have my thumb and my index finger holds the mask in place like so. And now my pinky, my ring, and my middle finger goes underneath the patient's mandible. And rather than pushing the mask to the face, remember that we're pulling the face to the mask. What this will do, this will ensure I have a better seal, and also I'm doing a head tilt chin lift, thus opening the patient's airway fully, so that way I'm encouraging more airway in between the patient's mouth and lungs. So if I'm holding the mask in place here, throughout the entirety of the call, this is all I'm doing. So responder 1 just holds the mask in place. Responder 2, while someone is holding the mask in place, now this gets attached to the bag valve mask like so, and now I'm squeezing the bag. A third of the bag with supplemental oxygen. Remember, this patient right now is in respiratory arrest, which means that we want to squeeze the bag, a third of the bag in a span of 1 second every 5 seconds. What that translates to is 12 breaths per minute, which is what we're trying to emulate because it's regular, normal breathing rate for an adult. Now, when we're providing assisted respirations, the key words are assisted. So if the patient is breathing, but they're not breathing adequately, time it to the best of your ability to squeeze the bag when the patient is inhaling. How I normally do that is if my partner has a proper seal the entire time, before I give that first squeeze, I'm squeezing that bag maybe 5%. The moment the patient inhales, I can almost feel air being drawn in from the bag valve mask here. So the moment I feel that being drawn in, I now start my clock. I squeeze a third of the bag, and then I count in my head, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And that's all I'm going to do for 2 minutes. After 2 minutes, we stop breathing for this patient, and then we reassess our patients A, B, and C all over again, and we act accordingly based on what the patient gives us. If you do not have a bag valve mask, then another option is we can use the pocket mask. Now with a pocket mask, sometimes it comes compressed like so. It's important that you want to take a look at your pocket mask, because some pocket masks just looks like this, and all it really protects me from here is it doesn't guarantee any protection from any airborne disease. All it really protects me are from fluids. So it's important that some pocket masks look like this. Other pocket masks also has a one-way HEPA filter check valve, which means for better protection, I would like to attach this to the end here. So what this ensures is that air can go from here to here, but air cannot go from here to here. Same thing as before. Pointy part goes to where the nose is, the round part goes to where the mouth is. Now, when I'm breathing for this patient using a pocket mask, I don't necessarily need to be facing the patient from head to toe. I can give effective breaths by being perpendicular to the patient. It doesn't matter if I'm on the right side, on the left side. Ideally, I'd like to go on the opposite side of my partner. Meaning, if my partner is on the left side on the patient, I would like to be on the right side. Same theories apply. Try not to think of it as I'm not pushing the mask down to the face, but rather holding the mask in place and then doing a head tilt chin lift. Once I do my head tilt chin lift, now I can give that same breath, a span of 1 second, 1 breath every 5 seconds. 1, 2, 3, 4, 5. And again, we repeat that cycle for approximately 2 minutes. After 2 minutes, whether we use a bag valve mask or we use a pocket mask, we stop the breathing, head tilt chin lift, breathing check, and circulation check. And again, we act accordingly based on the 3 potential outcomes. We've now dealt with the patient is breathing, and keep in mind, if they are breathing properly, next solution is you want to put them in recovery position. Option 2 is if they were